Interprofessional collaboration. Ideas for today and tomorrow. Concepts of interprofessional collaboration. Who's involved? What are the benefits to the patient? And what are the benefits to a facility? There can be many individuals that are part of interprofessional collaboration. Some of these individuals would include physicians, nurses, social work, physical and occupational therapy, and informational technology staff. The most important individuals that need to be included are the patient and family. There could be non-clinical staff involved as well, such as risk manager or quality and safety officer. Benefits to the patient and families are improved, safe, efficient, and quality health care with an increase in patient satisfaction and experience. A facility can benefit from reduced costs, improved staff satisfaction, and retention. This video from the advisory group is an excellent summary of what interprofessional collaboration requires.
So much of what we're trying to accomplish today requires collaboration across disciplines. Preventing readmissions, for example, reducing unnecessary utilization, better managing patients with chronic conditions and multiple comorbidities. All of this requires a truly collaborative effort. And it's not just good communication, it's more than that. It's understanding each other's roles and learning how to work together to solve problems and to collectively make the best decisions that we can for our patients. And that's not easy to do. In today's healthcare environment, we have larger care teams that are often more specialized. And let's face it, we're not always working side by side. We're not always in the same place at the same time. So the question then becomes, well, how do we do that well? We set out to better understand interdisciplinary collaboration. And as we spoke with healthcare leaders across the country who were most successful, there are a few themes that emerged. The first one is the most intuitive, and that is start with ensuring face-to-face communication is effective. If there's a new nurse who isn't comfortable sharing his or her concerns with a physician in the moment, it could be jeopardizing patient safety. The second is putting systems in place to bridge those barriers created by space and time, because we're not always physically working side by side. And then the third is ensuring that all care team members are working toward the same patient goals. We found in our research that this has to be both a bottom-up and a top-down approach. So you need that executive alliance, but then you also need to ensure there's a partnership on the unit between physicians, nurses, and allied health professionals all working together toward the same patient goals.
The triple aim. Care of older adults with chronic conditions, services that are not coordinated, inhibit safety, and the cost of health care. All of these things are what the triple aim looks to focus on. The triple aim focuses on improving patient and family experiences, with care improving the health of the population and decreasing the cost of health care. Working together can also help decrease the burden placed on individual caregivers in caring for patients. As the old saying goes, 2 heads are better than 1. As the population ages, patients have at least one chronic condition, if not multiple chronic conditions. This requires multiple disciplines to work together to care for this one patient and the challenges that come along with each of those disease processes. When teams do not work together, patient safety, quality, and cost of care is affected. Working together through the advancement of technology such as telehealth and electronic medical records allows for different disciplines to work cohesively together no matter where they are located. As educators, it is our responsibility to educate students in pre-licensure programs on the importance of interprofessional communication. When in the practice setting, educators need to lead the change by educating staff on how to use interprofessional communication, bringing different professions together and helping them understand each other's focus and the importance of the focus for the patient is the first step. This leads to understanding, trust, and respect for all team members. There are other important educational offerings like group process skills, leadership skills, conflict management, and decision making. These are all good courses for educators to develop to promote interprofessional collaboration. My own evidence-based proposed change is handoff for safety, patient bedside reporting. The evidence-based proposed change that I will be implementing is handoff for safety, bedside reporting. This change proposes that nurses will give report at the bedside with patient and family utilizing a tool to promote an organized handoff, including all pertinent information. Even though bedside reporting focuses primarily on the nurse, patient, and family, the other team members are key to complete care for that patient. The nurse is often the point person for information regarding the needs of the patient, but without social work, physicians, or therapies, the patient can no longer manage their illness or disability. Leadership is a key component to support the nurse with the change process and see the benefits of the change. Nurses are key players. They're in the middle of everything that occurs with a patient. Nurses listen to patients. Listening, in turn, leads to them having a discussion with the physician of any concerns the patient has voiced. The physician will then give the nurse an order for another discipline to see the patient. The nurse then contacts the discipline to share the information originally obtained from the patient and the request for the discipline to see the patient. All this information is then documented in the chart for all disciplines to see. Nurses also receive information from the nursing assistant and family regarding the patient. This is why nurses are at the center of communication regarding interprofessional collaboration. The nurse is often aware of more information than the other disciplines due to the amount of time that they spend with the patient. Collaboration. It takes a team. Collaboration requires a culture of individuals who share accountability for teamwork and patient outcomes. Bringing leadership, staff, and the educator together begins that collaboration for this project to develop a process which will support all individuals involved. Everyone's input is important and needs to be valued and respected. Sharing the information with the committee that will be implementing this change and having the discussions of the challenges so that ideas can be thought of to address the challenges is the first step. Then sharing this information with all staff through education will lead to support and an understanding that we all play vital roles in the care of our patients. After implementing handoff communication, allowing for all stakeholders to share their thoughts and ideas regarding the process continues to promote the team collaboration. Sharing results with all staff demonstrate the effectiveness of the change, and then staff will see the benefits if they have not already identified these benefits themselves. Communication. Communication is key, and there's multiple different types of communication that's used. Communication is a key part to handoff communication. Spreading the word with staff, engaging them in the process, and exciting them to be a part of the team is essential. Sharing facts with staff regarding the benefits of handoff communication for patients and themselves can help motivate staff. Allowing staff to share their knowledge, concerns and ideas regarding the implementation, and valuing the information they give creates an open environment. Utilizing a communication tool brings a visual content to the process. Practicing scenarios also allows for verbal feedback to the staff. Continued communication is required to work through issues and concerns, along with praising those who adopt the practice well. Benefits for the patient. It's patient-centered, improves health, decrease costs for the patient, and decrease the length of stay. Having the patient be at the center of the team allows for improved communication and the entire team to understand what the challenges are for the patient in caring for their illness. Communication avoids errors, helps the individual understand the treatment plan, and improves organization. That coordination of care allows for decreased costs by avoiding repetitive testing and, if in the hospital, decreased length of stay because the team is aware of the plan and can work towards the end goal. Benefits for healthcare providers. Everyone understands everyone's job. Fostering teamwork. Decreases medical errors. Improves job satisfaction. Respect and value for each team member allows for open communication. Education and open communication allows for the understanding of each other's role. All of these avoid medical errors, reaching the patient, and promote teamwork. When you have teamwork, positive patient outcomes and patient satisfaction improves. Healthcare providers are more satisfied with their work environment and more likely to stay in that job position. Final thoughts. Interprofessional collaboration is patient-centered communication involving all disciplines of the healthcare team. Through this type of team, improved patient outcomes, satisfaction, and the health of the population, as well as decrease in medical errors and healthcare costs, are possible.